Hey everyone, Dr. DeCubellis here with This Must Be the Place, and today I'm joined with Dr. Gibbs. Thank you for stopping by today.
Thank you for having me.
Yeah, no problem. And I wanted to have you here because obviously I want people to know kind of what you do, but we've got a lot of interesting questions. We've never had anyone in the dentist industry by before, so I wanted to make sure we can kind of answer some of those things. But before we get to kind of a deep dive into that, tell me why dentistry? Why did you get started?
So that's a great question. I'm actually a fourth generation dentist in my family. So all on my dad's side, my great-grandpa, my grandpa, my dad, all dentists, and actually all from the University of Illinois in Chicago.
Nice.
So when I was looking at schools and kind of my future and career, I loved ceramics, I loved art, but I also loved science and biology. So dentistry was such a great combination of those two. So dentistry.
That makes sense.
Yeah.
So now with dentistry, you are not just your typical dentist. Tell me a little bit about some of the things that you have done to specialize and some of the areas that you work in.
So when I was growing up, one of the things that was really big for me, kind of back to your other question too, was education. My dad is very huge in continuing education. So when I graduated, there were a lot of things that I knew I wanted to do. IV sedation, it's something that's great for dentists, or I'm sorry, for patients who are very afraid, who maybe have a long list of things that they want to get done but don't want to be fully awake to do it. I knew I wanted to do implants. I knew that there were a lot of things past just dental school that I wanted to do. So as soon as I graduated, I really focused on just getting as many things under my belt as I could.
That makes sense. And that actually makes you a better dentist because you have more knowledge base. But education is very important, obviously. I agree with you on that one. Well, let me ask you this. I think when it comes to dentists, a lot of people don't really realize everything that you can do. People know about cavities, but tell me, besides cavities and fillings, what are some of the other things that you do and can work on?
So, like you said, cavities, fillings, crowns, bridges, your standard bread and butter dentistry. Orthodontics, perio disease, gum loss issues, recession, and then, you can get into the more complex full mouth reconstruction, redesigning a smile, kind of taking everything down and building it back up. And then, sedation options, and then also addressing kind of the dental medical issue of things like sleep too. So there's so many things past just, I have a cavity, I need it fixed, but ways to improve your whole life.
That makes sense. Now, you said something really interesting there about the full mouth reconstruction. Tell me a little bit about when would that come into play? Why would someone need that? What's going on?
So a lot of times what you'll see is a person over their lifespan will have a lot of, it starts out as a cavity, it goes to a crown, maybe it needs a root canal, and you have a tooth or you have multiple teeth that have lots of restorations, and they get to a point where that tooth becomes very fragile and weak, and then a lot of times it won't just be one tooth but multiple teeth. And then when you go to evaluate what would be the best option for that patient, if you restore kind of everything in little pieces, or you try to restore everything to get it to an end goal, it ends up being, well, you could do it that way, but it would be more expensive. You might not have the outcome, like aesthetics, gums, bone position might not change. So then the more recent development of implants, you would put implants in and then have a bridge that's fixed on those implants. And that way you can reposition where the teeth are, the bone is, the smile. So it's a really nice way to kind of bypass a lot of the issues with outdated restorations, failing crowns, bridges, fillings, and get a beautiful result.
Okay. So, and it also gives you a little bit more ability to go in there and affect it the way you want to,
Right.
which means there's also less variables that you have to worry about. So a better result means happiness all the way around, right?
Yeah, absolutely.
That makes a lot of sense then. So tell me a little bit about the IV sedation, because I don't think that's something that a lot of people do. So kind of explain, what does that entail and how does that work?
Yeah, so actually 1 to 2% of the dentists in the U.S. have their sedation license. So it's something that I'm really proud to have, and it's something that I am constantly getting more and more education on. We're staying current on. We hold ourselves to anesthesiologist standards with the monitoring during sedation. But it's something that a patient will come in, and we offer nitrous and oral sedation with a medication, but also IV sedation where you can go a little bit deeper into sedation. It's more moderate sedation. You fall asleep and then the work is done and you wake up, and most of the time you don't even remember what was going on. It's a really nice way to kind of get over fear, to get a lot of things done at one time, and even patients that might have a gag reflex it's good for. So it's a really nice tool to kind of have in your belt.
Yeah, that makes sense. And also just being able to have different options for people, because every situation is going to be different. Now, let me ask you this, with that and the different kinds of sedation, do some of them not work, or I shouldn't say not work, are not applicable based on the amount of time the procedure is going to take? Like, does that play a role into what you might offer or suggest?
So the deeper you go in sedation, the less time you want to have someone at that level. So when you're looking at something like IV sedation, really 4 hours should be the maximum amount of time. So a lot of times what we'll do is kind of titrate slowly get someone to a level of sedation. Maybe do the majority of the procedures during the early part of the appointment, and then start to kind of taper off, and then maybe have them at a lower level of sedation for things like the cleaning. So there's ways to work with the levels to make it safe for the patient. And what we find that's really interesting is a lot of patients will start out doing IV sedation, a more deeper level of sedation. They get comfortable back in the dental office, and then they're doing, nitrous for their appointments, or, things. A lot of people have a traumatic experience when they're younger. They're afraid to come into the dentist. They come in, they get their work done, they meet us, they learn that, not all of us are scary. They get comfortable, and then they become just comfortable, happy patients.
That makes a lot of sense. So thank you for stopping by. I think that answers a lot of questions. People I think they want to ask. They don't get a chance to ask a dentist all the time. If you'd like to get in contact with Dr. Gibbs in her office, contact information is going to be below. I hope that offered a lot of good information for you. As you can see, she's very knowledgeable and has taken that extra step to get even more education in her background. So please go visit her, and thank you for stopping by.
Oh, thank you so much. Thank you.
No problem.